My name's Mark Rupp, and I'm from Omaha. I've lived here for about 2 decades now, and my kids grew up here, so this really is home for us. However, I do have some roots in Texas. I moved around a little bit in the United States as I was growing up, and in high school we moved to Texas, so I finished up high school, went to college, went to med school in Texas. Well, as an infectious disease specialist, we typically get thrown the curveballs. So we see the odd cases, the difficult cases, and I enjoy that challenge. So we see tough infections in the hospital patients, diseases that are very serious and need some real specialized attention. In the outpatient setting, we tend to see diseases that other doctors haven't been able to figure out. So there's a lot of challenge involved in the field that I find intellectually very satisfying. Well, I think that medicine is a field that gives you a huge latitude of being able to take advantage of your own personal skills. And so you can be very people-oriented, you can be very cerebral, or you can be somewhere in between. Academics gives you the best of all worlds. So I spend a lot of my time seeing patients and having that interaction with patients, but I also spend some time interacting with basic scientists that are studying disease processes at a very basic level. And so being able to see that mix has been very, very satisfactory for me. In addition, there's a lot of satisfaction that's involved with training the next generation of physicians and being able to impact the people through that method. Well, when I sit down with a patient, I'm trying to accomplish a number of things. First, I want that patient to feel at ease and that I'm caring for them. I'm expecting the patient to give me information on a very open, free type of exchange. And so you really do have to establish that rapport with the patient. I love microbiology, and so trying to examine that interface between the microbes and people is fascinating. And then sometimes, unfortunately, it goes awry, and that's where we step in and try to restore that balance. So one of the nice things about infectious diseases is that for the most part, you're able to cure people. And so that's a tremendous satisfaction there when you're able to really see a disease, treat it, and bring somebody back and fully restore their health.